Our next question is going to be, who is a poor candidate for aesthetic surgery? So often we hear about all of the good reasons that a person might consider cosmetic surgery or non-surgical rejuvenation. And indeed, the vast majority of people are good candidates. But who are the people who are not good candidates for cosmetic surgery? These are very important people to identify, not just for the surgeon, but indeed for the patient. It's important for you to understand that our goal as surgeons, certainly my goal, is always to do what is in your very best interests. This means primarily, can we improve your quality of life through some type of intervention? How do we improve your quality of life? We can do this by giving you a feeling that your outer appearance, your face, reflects your inner spirit, that there's harmony between how you look and how you feel. This may mean changing the shape of your nose, setting back your ears, augmenting your chin, or rejuvenating an aging face that's sagging or losing volume or has too many wrinkles. And if we can improve those things objectively to make you feel better, then we've achieved our goal. But there may be some people, for example, who just physically are not well, whether it's diabetes, whether they're really heavy smokers, whether they have other systemic medical diseases. They may not be good candidates for certain procedures. We also need to look at the specific request that a particular person has. If that person has a request to improve something that we really can't improve very much with our own treatments or surgical procedures, then we must advise them of this. It's much better to be unhappy with something you don't like about your face without a treatment or operation than to be unhappy after a treatment or operation. And so we need to look very carefully at what tools we have to see if we can achieve what you want. And finally, one of the most important things is everyone must recognize that the goal of all of this work is an improvement. We're not trying to make a 50-year-old look like a 30-year-old. We're trying to make you look terrific for your years, indeed perhaps a few years younger, or improve a nose that looks very, very out of place for your face. But the main thing is that we're trying to make you feel better, and therefore we must meet your expectations. So a person who is a perfectionist may not be a good candidate because we can't always get perfection. Someone who is prone to depression all of their life may not be a good candidate because this kind of work is not going to resolve those issues. And other people who have other more serious psychological problems, they may not be good candidates because surgery is not the answer for them. The treatment is to deal with those other issues. However, as stated, the vast majority of patients are excellent candidates, and as long as we work together well in a partnership, which we do, then we can achieve a very satisfying result for the vast majority of our patients.